And we are live on air. Okay, hi everyone, welcome to our webinar. Thank you very much for being here today, for taking the time to be here today. I'm going to show you how to use our platform, what is AMBOSS, and how to make best use of it today. I hope, first of all, you are all healthy and safe. And let me first introduce myself before we take our deep dive. So my name is Margherita. For those who don't know me yet, I'm originally from Italy. And I joined the AMBOSS team exactly a year ago. And I've been working a lot, especially with Italian medical students in the last year, and with Italian students associations for medical faculties. So I'm actually very happy to be here today, because especially with your school, so Unimi, we've been doing great things in the last year. So I'm very happy that I can guide you, and I hope that our platform will actually help you and help you optimize your way of studying medicine. So today I'm supported by my colleague Camilla. She will support me, and she will be in the chat. So whenever you have questions, don't hesitate to just drop your questions in the chat section. Otherwise, we will have at the end of the webinar approximately 5 minutes to answer your live questions. So you will be able to participate, to speak. There is actually a little icon, speak. So you see the hand there, down there. So if you click that, you will be able to request to speak. So we will have a section for that at the end. As I said, feel free to share your questions in the chat, and check out our polls section there, because we are going to have a couple of questions for you so that we can better get to know each other. So now let's start. I'm going to share my screen. So there will be a very short presentation just to introduce AMBOSS in case you don't know much about us. And then I will start a platform tour so that I can we will be able to see in detail how our platform is structured and how you can use it. So let me first share my presentation. Okay, just a second. Okay. So here we go. So let's start from the first slide, of course. So why are we here today? Well, you know that your university purchased AMBOSS a few months ago, right? So that means that you have access to our platform for free. And that makes you actually quite lucky, because normally, as you might know already, you must have paid access and individual paid access if you want to use our platform. But thanks to the ongoing collaboration that we have with your university, with Unimi, you can have access for free to the library, to our library, and you can have a maximum of 50 questions a month to use within your account until June the 1st, so 2021. So let's first see, I would like to share a couple of fun facts about AMBOSS and Unimi. So since the campus license, your campus license, your access, thanks to the university, has started, we have today 451 registered students at Unimi actively using our platform. It seems that you prefer our questions. So as you can see, you answered a total of approximately 64,000 questions. and you approximately read for 40,000 articles. And mainly the best usage of the platform comes from students in their 4th, 5th, and 6th year. However, we've been noticing an increase in the last months of students coming from the 1st year and physicians, because even if you graduated and you are outside of medical school, you can still use AMBOSS because it's an e-learning platform. Of course, it helps medical students improve and optimize their way of studying. However, we have a feature, and I'm going to show you that later on during the presentation, which is called the Clinician, which is made especially for physicians because it allows you to see to access very detailed information about patient management. So we will see that in detail later on. And it seems that the 3 top articles are cardiology and angiology, neurology and endocrinology. So I'm going to show you maybe a couple of articles from these subjects to see later on how our library and our articles are structured. So other than these fun facts about our collaboration between AMBOSS and Unimi, so what is AMBOSS? Why is this platform unique, and how can you use it? So you know that if you have already started using the platform, you know that we have 3 main components, 3 main sections, which are the knowledge library, including all preclinical and clinical subjects, the question bank, and the analysis tool, giving you an overview about your overall performance. So in that case, and we will see that in detail later, in that case, you have access to your performance to see how you can better structure it, because it highlights your weaknesses and your strong points of your preparation. In other than the online platform, so you can perfectly use, as you know, the platform online. However, you can download our apps. So we have one app for the library and another app for the question bank. So it's 2 applications that you need to download to have complete access to the platform. And the good news is that you can use them offline. This is really important because it's actually part of our main goal, which is allowing students, medical students, to get access to medical education regardless of the location and regardless of the of other parameters. So making medical education accessible from everywhere, from anyone. And so this is extremely important because if you're traveling or if you're not at home, simply not at home, you can still for example, test your knowledge before an exam, or just practice your knowledge thanks to our question bank, or quickly review for an exam thanks to the library app. Otherwise, you can definitely use the platform with other devices such as the tablet, iPad, and so on. So other these information, why you might need this platform for your medical studies. So why is AMBOSS unique? You certainly, as medical students, you certainly have been using other tools in your medical career since you studied medical school, and you definitely know that there are multiple resources which are available online, or just even textbooks where you can practice questions, for example. But why is our platform unique? So we have basically AMBOSS can integrate different areas. So you have, first of all, other than the 3 main sections that I just mentioned, which are, let's repeat them, the library, the question bank, and the analysis section, you have unique features. So, and we will see these in detail, but just to mention a couple of these features, we have the highlight feature, highlighting the most important sections in your when studying an article, for example. In yellow, we have the overlay feature, which helps you explore visually. Basically, this is extremely important when it comes to radiology images, for example, which are sometimes very, very hard to read. And thanks to the overlay feature, you can immediately spot the essential points of an X-ray image, for example, or a CT scan image, so that you can really focus on what's the most important part and the most important information about the image. Or we have the difficulty meter. So you can customize your sessions, your question sessions, for example. You can select then the difficulty level depending on your needs. So these unique features, of course, improve your performance, leading you to a higher performance. And it's a tool then integrating all these components. And depending on your needs, it can be really a perfect fit for your daily studies. Then, many times, often students ask us, how is our content created? Because of course, if you want to study with our platform, you must trust our information, our sources. Otherwise, as a medical student, you want to make sure that what you are studying on, what you're reading, and what you're looking at comes from reliable information. So first of all, we have an editorial team. Our editorial team writes the content, the medical content, and it's composed of more than 70 physicians approximately. However, there is a specific workflow. So it's not that, for example, we have random physicians writing random content. Each information, every single information you read is the outcome of a specific workflow. So first, we have a first physician, so a content editor starting writing the content. Then there is a second physician cross-checking on what the first physician has written. Then there is a third component, a third editor who proofreads everything. And then in the end, there is a supervising editor. So we have in total 3 physicians working on this content. And you will always be able to double check, for example, our references within our library. So I'm going to show you that in a bit. So in case you just want to make sure that these information comes from reliable sources, you will always get a list at the bottom of each article where you can have a look at our references. So at the references our editorial team has used to write that content. So how can you use AMBOSS? And so now we can start analyzing better our platform structure. So we have, as I said, the knowledge library, the question bank, and the analysis tools, right? Let's see how they are linked to each other, making our platform interactive, because this is also a feature, the interactivity of our platform, making AMBOSS a unique tool. So I'm going to switch and I'm going to open now another window. So we can go to the our main page. So normally, if you have already activated your access, so Camilla will post in the chat the landing page link, so the dedicated landing page we created for Unimi, where you get all the most important information about how to activate your access. So once you create your account with your institutional email address, you can then surf to the main web page and log in. So here, for example, I guess you can still use my, you can still see, sorry, my screen. You can then, once you create your your account, sorry, you can log in. So let's click here. And once you are inside, you have to go here to account, where you can actually select your university. From the drop-down menu, select university, you receive a confirmation email. And once you receive the confirmation email, you confirm it, and then your access is activated. For any technical questions or issues, you can always email hello@amboss.com. So that's our technical support, our customer support, and they know that you have a campus license. So if you have technical issues, please always send them an email, and they will be happy to answer you and help you. So once you log in, now we are in the platform, right? This is our main dashboard, where you get basically a kind of a resume of your performance and activity. As I mentioned before, you have three main sections here, which are the essential sections of our platform. So let's start from our library. As I said before, our library includes both preclinical and clinical subjects. So even, for example, most of you have been using AMBOSS for their clinical years, so for the 4th, 5th, and 6th years. You can actually use AMBOSS even if you are a first-year student or a second-year student, and so on. Because, as I said, we have a basic sciences section that you can see here, where you can access different folders by discipline or by system, for example, here. And you get all the most important preclinical subjects and folders. This is a way you have to access the medical content. However, you can also just type here in the search bar your article, the topic you want to study for, or simply a keyword. Even a keyword is enough. If you want to see whether we have that information or not, or a dedicated article, you can just type in the search bar the name, and then you will get a list of the main results, including that keyword. So other than the basic sciences section, you have clinical knowledge and clinical skills. So clinical knowledge is based on the same principle. So you have here multiple folders, including all the articles per discipline. However, in the clinical skills, and we are going to see these in detail in a few, here you have a section where you can really practice your clinical skills. So we have a series of cases listed by symptoms. And for each case, so for example, here, abdominal pain, you get like a kind of a simulation of a patient examination. And you can, for example, practice these with one of your classmates, for example. Since now we are pretty much all forced to study and work remotely, having something like this can actually help you a better study during the day and practice even if you can't do it at the moment, because the situation might change very quickly because of COVID, unfortunately. And sometimes there are still in other universities as well a lot of you students who haven't started their traineeship yet, and who haven't started their rotations depending on the hospital's availabilities. So having something like this, a dedicated section to clinical skills is extremely important, especially in these days. So before we have a look at this section, let's just type here, for example, the airways and lungs article. So as I said, as soon as you type here, you get a list of articles, and or if it's just a keyword, you get other articles that are linked and connected to that keyword. So let's open our article here. So if you have already used the platform, you know that normally all our articles are structured like this. You always get on the left-hand side here a list of the main paragraphs. So you can easily jump from one paragraph to another by just clicking on these names. And if you expand all sections here, you open the article, and the first thing you see is always our summary. So the summary basically gives you a detailed introduction about the topic, telling you what this topic is about. And you can immediately spot some underlined terms. As you can see here, there are these terms. If you look here, what do they mean? Basically, if you hover over one of these terms, as I've just done, you get a pop-up window like this, in this case, giving you a short description about this concept. And you can then click on the link here, the equivalent link, and you can be redirected to the section where this concept is mentioned. So why is this important? Because as medical students, you know that when you need to study, it might happen that you, for example, forgot about a specific meaning, about a specific term, and instead of opening hundreds of different windows in your browser or textbooks or looking for the information you need somewhere else, you have everything you need just in one place, in one spot. So this is also one of the main features that is extremely appreciated by our students, because you, as I said, you save your time, and you know that time is precious, is extremely precious when studying medicine. Then once you read the summary, you will be able to see that for all our articles, we have multiple multimedia files, which are also extremely appreciated by our students, because you definitely know that when you need to study, if you have visuals helping you and guiding you as you study, it really reduces the efforts you do, and it improves your memorization process and your learning process. So, for example, we have integrated videos like this one. So you definitely know Osmosis. I'm pretty sure that many of you know it. They are quite famous, and they have a YouTube channel, and they are quite famous because they explain complex medical subjects with a nice and easy way, so an easy exposition. So they use these nice graphics to really boost your learning process, and they give you visuals, very nice visuals to simplify this process. So AMBOSS and Osmosis have a partnership, and this is the reason why you will always find many of their videos in our articles. Then we have different charts, diagrams, images. For example, this one. If you open, so imagine that you are in your preclinical years and you're studying anatomy, for example. So in this case, you have a structured image, a detailed one about the trachea structure, right? So for each image, you always have a caption. So if you click here, caption, you will always get on the right-hand side a description of the image you are looking at, telling you exactly what you are looking at, and guiding you to let you process the image. And if you want to immediately, for example, test your knowledge once you while you're studying, you can even play a little bit with the indicators and labels like this. You can just take them off, and you can already start challenging your memory. If you even have a start quiz, like if you can see here, there is this kind of a highlighted section. And thanks to the quiz, you can already test your knowledge and answer the question. So it's a very active and proactive way you have to study medicine, even when regardless actually of the complexity of the topic, because we added quizzes to both to preclinical subjects and clinical subjects. So it can vary a lot. It can be very different depending on the subject. But other than these quizzes, we have tables like this one, for example. Tables always include complementary information. So here you can always find additional details regarding this article, this specific topic, and these details are always listed in a very clear and simple way. So you can actually see here that it's a clean way to list this information, because you definitely know that sometimes all the medical content, medical knowledge in general can be overwhelming. And there are so many things you need to memorize, then there are so many things you need to handle. And if you can actually use sections like this one, for example, helping you reduce what is not necessary and helping you focus just on the essential points is definitely a very good hand for your daily approach to medical knowledge. You can always maximize these tables, like in this case, if you want to have a better overview. And even in this case, you can start a short quiz where the content gets blurred, like here. And again, it's the same principle that is testing your knowledge while you're studying. Then other than these tables and the other files, as you can see here, we have further images. And I'm going to show you one of the features that I mentioned at the very beginning of my presentation. So the overlay feature. So if you open this one, so this is a typical chest X-ray image, right? If you, once you read the caption, like in this case, you read the caption, you have a better understanding of what you're looking at. However, you know that when it comes to radiology, as I said, it's often quite hard sometimes to spot the areas you need to pay attention to. And thanks to the overlay feature, if you enable it by clicking here, for example, here we are looking at the upper lobes and the middle lobes, right? In this chest X-ray image. And if you're studying anatomy, this can be very useful. And this feature can actually be even more useful if you are in your clinical years, because in that case, when you have an X-ray image, if you are already practicing medicine, in that case, you don't need to use the overlay feature to just to study, but you need to use the overlay feature to diagnose, to spot the abnormalities you should be looking for when diagnosing a patient, for example. So in that case, the overlay feature, for example, here we have this CT scan image. So here we are talking about pulmonary embolism. So in this case, as I mentioned, you imagine that you are about to approach a patient, and you need to diagnose, and you need to have a very detailed overview about his or her situation. So in that case, if you enable the overlay feature, you can see here these green areas, and these areas represent the exact points where you need to pay attention to when diagnosing a patient with a pulmonary embolism. So the overlay feature can be extremely useful, as I said, as I just showed you, in both cases. So either you are preparing for just an exam, or you already studied your rotations and you want to practice a little bit more, like if you are with patients already, and you want to see how you can make best use of this feature in those cases. So other than the overlay feature, we have the microscope feature, so the super zoom feature, sorry, with microscope images. So In this case, for example, as usual, you always get the caption on the right-hand side. But if you enable the Smart Zoom feature, you can use this super powerful zoom and zoom into the image, and you get these little red dots here. And if you click on these dots, you get a short description telling you exactly what this point in this image represents. So here, for example, this plays an important role in a histologic differentiation between pulmonary arteries and veins. So as you can see, as you can read here. And of course, this is extremely powerful if you're studying, because you don't get the chance to always access this kind of information while studying normally at the university or during your classes. And this is an additional tool that can really boost your performance while studying. And as I said, at the end, you always have the references. So imagine that after you studied this specific subject or topic, you want to have a look at the references our editorial team has used, so you can always find them here. So other than these articles, as I said, if we go back to the library and we go to the clinical skills section, I wanted to show you this because in the dedicated landing page we created for Unimi, where you can have all the information to create your account, access, and so on. There are two videos that I personally recorded in Italian, both in Italian and English months ago. But in the English video, I don't show this section because I didn't have enough time to do it. This is why I would like to show you one of these cases today. So for example, let's open case number 5 about nausea. So here, as I said, if you're not going to classes at the moment, or if you have just partial classes, whatever, and you want to practice a little bit with your classmates, or just even with your family members, for example, and or just by yourself, these cases are extremely important for patient management, as I said, because the structure stays pretty much the same. So if you compare these cases to our articles, our normal articles, they look exactly the same. However, here you immediately are you can really take a deep dive into an examination, a simulation of an examination of a patient examination. So in this case, you have examining instructions. You have all, for example, the scenario telling you that this 19-year-old female has these vital signs and presents these symptoms, for example. Then you have a section telling you how you should deal with the patient. So you have patient instructions for the patient, also for the patient. You have focused history, and then you have here a checklist. So you can actually, for example, here, regarding the color of this patient, right? It happens more when my stomach is empty, so it is usually clear. Okay, and you do like this, for example, you check these boxes. In case you actually find a correspondence between these situations and this patient case. So you can really even have fun somehow with these cases, because they really represent an interactive way and not a passive way of studying medicine. And this is extremely important, as I said, especially if you are in your clinical years and you're about to start your rotations, maybe. Other than this, let's go back quickly just to, for example, pneumonia, this article, because I would like to show you how you can review, for example, for exams by using specific features. So as I mentioned at the beginning, you have the highlight feature here. If you enable it, you can see here highlighted in yellow the most important parts about this topic. And imagine that you are about to embark on an epic exam session and you don't have much time. You're running out of time, you are a little bit stressed, and you want to review, you want to focus on this subject, right? So in this case, pneumonia. As I said, you don't have much time. So instead of going through the whole topic again, basically the platform can filter for you the most important information. So it takes, it removes the information you don't need. So what is not essential in this case. And you can then use the highlight feature combined with the high yield, like in this case. And if you combine these two features, the amount of information is suddenly reduced. So you really get the essential points here. And you can really focus on what is fundamental for you to deal with this topic and what you really need to understand and study for you to have actually a complete overview about pneumonia. Then if you want to immediately test your knowledge, you can always, for example, activate the learning radar. And as you can see, if you do it, you have here these red sentences, red terms. Basically, they indicate you what you got wrong during your last question sessions. So thanks to the learning radar, again, if you are in the scenario that you're reviewing, that you want to review for an exam, or even before a class, and you want to see how your performance is going, and if you still have some weaknesses, some lacks of knowledge regarding this topic, you can then enable the learning radar feature, see what you still need to focus on, what you still need to work on, and you can, for example, open a question bank session and filter just the questions that you answered incorrectly during your last sessions. So in that case, you can really focus just on these. And here you can adjust the number of questions. For example, let's imagine that, as I said, you don't have much time. You just want to quickly review what you got wrong by doing these questions, other questions again. You start a session and then you are inside. So you have access to, as you can see here, this is the total number of questions. And our clinical cases, so all our questions are based on clinical cases. And you have here all the options, and for each option, you always get an explanation telling you why that option is correct or incorrect. So imagine that you start reading this case, but and once you do it, once you finish, you are still unsure about the answer. In that case, you can get some help. You can use the key info, so underlining the keywords, the attending tip, which is a hint the platform gives you, and it doesn't give you the answer. So it's not like a 100% help, let's put it that way, but it's just a hint for you to develop your critical thinking, because you know that as future doctors, you will always have to find your own solutions in an autonomous and creative way. So we want you to focus on your critical thinking by giving you these tips in these cases. So when it comes to clinical cases. And then you can always have a look at lab values, like in this case, for example. So once you think that you are ready to give your answer, you go here and you select the question you think is correct. In this case, this is not the correct answer. Let's open them all. And as I said, for each of these options, you always get an explanation. And you can still have these underlined terms here by giving you the chance to immediately access to for example, this concept, in case you have forgotten what this means. And if the information is correct, like in this case, you can click here and you can immediately have access to the article where this concept is explained. So it highlights here in green the right answer, giving you the chance to go back, for example, here. So we are in this article. And so the platform really makes your life easier by giving you the chance to quickly review, even when you are already reviewed for a specific topic. So you can do everything just in one place. And as I said, otherwise, you have this option to access our questions. So from the article to the question bank session by clicking this button, as I just showed you, or you can customize your questions. And to do so, it's very easy. You just have to go to question bank here, create a question bank session. And here you can select different filters. And among these filters, you have the difficulty matter that I mentioned at the beginning during my presentation. So imagine, for example, that so as I showed you at the beginning, it seems that you are many of you have been using the platform for cardiology and endocrinology, for example. So let's select the endocrine system, and let's select an easy difficulty level. Okay. Here, for example, either you use the automatic title the platform gives, or you can rename your sessions. So why is this important? Because you will be able to find your sessions in the analysis section. And if you rename them, it will be easier for you to easily resume these sessions whenever you want. So you will just have to go to the list that I'm going to show you in a bit, resume the session, and it's going to be very easy for you to have access to your customized sessions and to find them again quite fast. So here, for example, easy questions, endocrine system. Here I can adjust again the number of questions, and you can use either the study mode, which is exactly which looks like what I just showed you in the previous question session. So in the study mode, you get the key info feature, the attending tip. Or otherwise, you can practice with the exam mode. So here you really, if we open it, you really get you're simulating an exam, right? You can use the calculator, the lab values. In this case, you can write notes, for example, here. And then you have the time here, the list of your questions. And as you can see here, the interface completely changes because we want you to really simulate an exam, and you don't get any help. You can end this block, and you will always be able to resume this block in the analysis section. So to do so, for example, if you go here, we go back to the analysis section. You have either a study summary. So here where you can have your overall performance, you can have a look at it. You can get the percentage of questions answered correctly with help, or incorrectly. And you get study recommendations. So the platform tells you, hey, you should focus more on this topic or that topic, depending on how you have performed so far. So you, in this case, you don't feel lost anymore. You actually have a proper guidance for your daily studies, which is extremely useful because, of course, you have professors, you always have classmates you can study with. However, you will always be the only one having a detailed overview about your own performance. And in this case, if you, while you're studying by yourself, if you want to focus on those points, you can then benefit from these analysis tools, really guiding you through your studies. And as I said, if you go here in the last session, here you can have the list of all your sessions and you can resume them. Here, the first one is the last one, so the most recent one, and you can always resume it and start it again. Also, last but not least, before we conclude this platform tour, you can have here the study plans section. So if you're studying for international exams, such as the USMLE or the IFOM, you can really benefit from these blocks here that are exam specific. Otherwise, you have clinical online courses, so clinical study plans. And for example, if we open this one about cardiology, you get a combination of articles and questions focused on different topics. So if you don't have time to create your own sessions and you want to review for specific disciplines, you can just, for example, go here and use one of the online courses we have created for you. So in this case, the basics of cardiology, you open it, you have the main articles about basics of cardiology, and you can immediately start a session, a very short session, about this topic. So you can really benefit from it. So this is pretty much it. I'm going to stop sharing my screen here, and I'm going to be back here. So now I can actually see, your questions, because I wasn't able to look at them while I was speaking. So if you have any questions now, you can actually ask your questions live if you want. Otherwise, let me have a look at what we have here in the chat. So Anushka asked if the questions are from the question bank or from the case studies. I'm not sure if by case studies you are referring to the clinical skills section where you have the list of cases. In that case, no, because our questions are something else. Like our question bank is a separate section. So you have the clinical skills section and the question bank. These two things are separate. So the questions you find in the question bank are clinical cases, so are based on clinical cases, but the clinical skills section shows you actually articles based on clinical cases. So it's a different thing. I hope it's clear. So from one side, you get a detailed explanation about how to deal with that clinical case. And whereas in the question bank, you have the chance to test your knowledge. So you have immediately access to questions and not to articles based on clinical cases. So I hope it's a little bit clearer now. And someone else, okay, thank you, Anushka. So someone else asked if the osmosis integration video are available to watch separately. Unfortunately, no. They are integrated in our library. So if you want to have access just to the osmosis videos, you can easily just make use of their videos on YouTube if you want. But in that case, it would be something completely different than having access to the whole library, integrating these multimedia files. So I hope it answers your question. So someone else asked if this webinar is recorded. Yes, is recorded. So you will be able to actually see this webinar later. And by the way, I guess that if you're attending this webinar today is because you don't, maybe you are international students or you're studying you are enrolled in the international degree program. However, if you speak Italian and you understand Italian, there will be a second session on Thursday this week. So at same time, it's going to be at 11 a.m. So in that case, you will be able to watch this presentation once again, if you're not tired yet of me talking. Otherwise, in the landing page, in the dedicated landing page, that you can see in the chat. There's the link there. So you will be able to actually, maybe I can quickly share the screen to let you see where you can find this information. So this is the landing page, the dedicated landing page for Unimi, right? So here, as I said, you can get all the information regarding your access. You have all the most important questions related to your access here. So what does the campus license mean? How you can use your access. Remember that you have access to a maximum of 50 questions a month. That's the standard access Unimi has at the moment until June 2021. And I wanted to show you here that in case you want to have another platform tour, you can always have a look at these videos that I recorded, as I previously said, a few months ago. So both in Italian and both in English. So even if you don't have access to this specific recording of today's webinar, you can always have a look at these platform tours, and it's pretty much the same the same thing. In the English tour, I show you other articles, but in the end, the main features are duly explained even in that video. So I hope it can be useful in case you want to review once again and watch once again this presentation. Then, okay, Sivan, you just asked how many questions you can do a month. So I hope I just answered your questions. So I repeat it again. It's 50 questions a month. So that is our standard access. Normally we have plus access as well. So there are two kind of packages, standard and plus access. Unimi has a campus license just for standard access. So we will, of course, be able to see at the end of this campus license period if your university will continue with us, will continue with the platform, if the kind of access will change. So we will certainly be able to tell you more in the future, in the upcoming months, about the kind of access you will be able to get. So if you have other questions, don't hesitate. Someone has requested to speak, so let me accept it. I don't know if it has worked. I don't think so. Or maybe it was just for the question I just answered. We still have 2 minutes actually. So if you have other questions, don't hesitate. I hope I really hope it was useful. You can always email, as I said, our technical support, hello@amboss.com, or let me write here my email address if you want to send me a private email. I will be very, very happy to assist you and answer your questions. So it's mmi@amboss.com. So let me write again my name. So my name is Margherita. Yes, that's pretty much it. I don't think there are other questions. So thank you very much once again for taking the time to be here today. Okay, there is another question. Could you just clarify the 50 questions thing? So as I said, you have a maximum, a limited number of questions that you can answer a month. So it's 50 questions a month. That means that your access to the library is unlimited. So you can surf to our library, you can open as many articles as you want. You don't have any limitation, any limited access about the library. but you have a limited access to the question bank. So you just have 50 questions a month to answer. And that's it. I hope I answered to your question. And that's part, as I said, of your standard access. And well, now I thank you once again for your time and for your attention. And well, I hope I can see you maybe one day in person if we will ever have the chance to host workshops and webinars at your school live. So in person, that will be wonderful. And I hope we can do that anytime soon. So thank you once again for your attention, and I hope you have all a great day. Thank you very much.